Now, the lack of exclusive breastfeeding and proper feeding for under 5 children has been identified as one of the major factors responsible for stunted growth in children. During a 2-week capacity training in Kwali, organized for health community volunteers by the Ministry of Humanitarian Affairs, Disaster Management and Social Development, women were advised to adequately feed their children in order to enhance their growth.
In line with the mandate of the Ministry of Humanitarian Affairs, Disaster Management and Social Development, to feed school children through the Homegrown School Feeding Program, the ministry organized a 2-day capacity training implemented by First Humanitarian Medic Plus initiative on infant and young child feeding, nutrition screening, healthy eating, dietary diversity, good manufacturing practices, and WASH. Project Manager, First Humanitarian Medic Plus initiative, Dr. Yusuf Abdul Rahman Bashir, explains the importance of child-intensive nutrition.
This intervention is meant to complement effort of the school feeding program. While the children are being fed in school, given a nutritionally balanced meal, their parents also are now being enlightened. So the essence of this initiative and the intervention is to raise community awareness, improve community knowledge on child nutrition and health, because child nutrition affects learning outcome, and then it also affects productivity in adults' life.
State nutritionist, FCT Primary Healthcare Board, Mrs. Clementina Okoro, says good nutrition is key for the development of children in their formative stage.
Early child nutrition is very, very important because it is fundamental. It is needed. It's a key for development. It's important for child survival, and it's also important for the child's brain development. It's important for the child's overall development, including all the physiological development.
The participants share their experiences during the training.
We are made to know that exclusive breastfeeding creates bonding between mother and child. It makes the mother and the child always be together, and it reduces costs for the family.
Exclusive breastfeeding. Not that when the child have already breastfeeding for 6 months, you started exposing the child into food. First of all, you learn how to give the child water gradually. Before starting giving the child water, you wash your hands properly. After washing your hands, make sure you wash their cups very well and their plates before you introduce them to any food.
Good nutrition plays an important role in the health of individuals, as it helps in reducing the risk of some diseases by building the immune system against diseases such as diabetes, stroke, cancer, heart disease, and mental disorders. The Homegrown School Feeding Program seeks to improve the health of school children, increase their enrollment, retention, and completion rate in school, thereby enhancing children's active learning capacity and alleviating short-term hunger. Lois Abasambu, ASO Television News.